arrested. Although, we get to compare this, also get to compare the offenders against children with offenders against adults, who are also caught, and we still see the difference. The next large set of studies were using CT studies. If you remember, CTs were what MRIs used to be. In those days, there were two different theories being expressed. This is your brain. This is your brain in your head. So in smaller rooms, I usually like to stand in front of the projector, so the big brain kind of... Now, there were two theories going on at the time. I called them, or nicknamed them, the frontal lobe theorists and the temporal lobe theorists. And these two groups of scientists were debating for many years. This yellow area really depicts the main part of the frontal part of the brain. And the reason that people were suspecting that is that's the part of the brain that's associated with inhibition, or, in brain injury, disinhibition, self-control. People with injuries in this part of the brain lose the ability to control their own behavior. People who are malformed or have less formed brain in this area of the brain are very impulsive. So there are some people who believe that sex offenses were the result of impulsivity and theorize, therefore, that it's this area of the brain that we would find differences in. Personally, I never bought the frontal lobe theory. Sex offenders are not particularly impulsive. There exist, for example, many pedophiles who are completely able never to offend. They're genuinely pedophilic, but if anything, they show a greater ability to inhibit their own behavior. Then there was the other group that I call the temporal lobe theorists. That's the temporal lobe of the brain, and it's kind of inside the temporal lobes that are what's called, remember the 4 F's? They were the 4 instinctual behaviors in humans. Fleeing, fighting, feeding,